Hi, everyone. This is Heather DeBendris. So today we're going to start with a high-level overview, just a reminder of the ways that you can submit your cumulative weekly COVID-19 vaccination data to our weekly COVID-19 vaccination modules. So first two are unchanged, so you can continue to report data through the data entry screen on the COVID-19 vaccination module page within Nhsn. That is unchanged. You also can continue to upload those weekly COVID-19 vaccination CSV files through CSV if you so choose. But this third option is new as of just the end of last month for long-term care facilities. So as of March 28th, long-term care facilities can also use a new optional event level COVID-19 vaccination form within the application. And if you use that form and then remember to click View Reporting Summary and Submit, you can submit those data in aggregate directly to those weekly COVID-19 vaccination module. So this is similar if anyone on the call today has previously used our optional Excel data tracking worksheets. It's a similar form of assistance, but it's much more user-friendly and has offered some additional simplification. So that is what we will focus on today. And just to drive home that point here, but today's webinar will focus on this option 3, these new event level forms. So if you have any questions about the first two options or summary data, you can go ahead and email nhsn@cdc.gov. But any questions related to this new optional form, you can go ahead and enter in that Q&A box.
Thanks, Heather. And again, like Heather just said, we have previously provided the Excel data tracking worksheet to track the person level information on residents and healthcare personnel. And what we essentially did here was build those Excel worksheets into Nhsn. So more of the process will be automated for you. And we're considering these to be enhanced versions of the data tracking worksheets that allow you to track the individual person information. And then Nhsn takes that individual information and calculates the sums for you and also populates those sums into the form. So you just need to manage your person level information, click View the Reporting Summary and Submit, select the week that you want to submit data for, make sure the data looks good, and then click Save and Submit. So it really simplifies the process. So now we'll get into a data entry and submission overview. This slide shows how to access the event level COVID-19 vaccination forms. So first, you must be a SAMS level 3 user in order to access the event level vaccination forms within Nhsn because this is person level information. So if you are a SAMS level 3 user and you enter into the long-term care component and you navigate to the COVID-19 tab here on the left side of the screen, and then you will select either event level COVID-19 vaccination form for healthcare workers or event level COVID-19 vaccination form for residents.
So you might be wondering how to enter that information for an individual once you navigate to one of those forms. So this example here is showing how to enter that data for the resident form, but the step is similar whether you're entering data for residents or staff. You're going to start by clicking that Add Row button shown by a red box in the upper left-hand screen. You'll click Add Row and then you'll enter in all of the required fields on that yellow section at the top of the field with the individual's data and click Save Row. So Hannah, how do we know what fields we have to enter?
Right, so on this last slide, you saw that some of the fields were marked with a red asterisk, and those fields are required in order to be able to save the row. And so this includes the resident identifier, the resident admission date, the first name, last name, and then in addition to those fields, you need to have at least one vaccination status entered, which means that every individual must be classified into at least one of the main categories of either partial vaccination or complete primary series or medical contraindication or declined or unknown vaccination status. Without having one of those entered on the person's row, you won't be able to save their information. And Heather, how do we update vaccination information for an individual?
Yeah, so this is one of the really cool things about the event level form being in the NHSN application. You can capture changes in a single row as someone's status changes over time. So when their status changes, you don't have to enter a new row or delete the old status. You just add that new status to the existing row. So we'll walk through an example of some screenshots on the next slide, but just to kind of create the framework here. As an example, if we had a resident that declined vaccination during the week of 1/1/22, and then she later decided to get vaccinated on 2/6, you would have initially entered that declination date on January 1st for your reporting for those weeks. And when she did get vaccinated, you wouldn't delete that declination date. You would just add that new vaccination information, that first vaccine on 2/6, to her existing row. And when you clicked View Reporting Summary and Submit, those data would be transferred for the relevant weeks. So Hannah, maybe you can walk us through that in closer detail here.
Sure. So this is the example that Heather just walked through. So initially, when she is admitted to the facility on 1/1, she declines vaccination. So that's what you see in this top half of the screen. So we have her admission date of 1/1, her first name, last name. She doesn't have any doses. And so what we enter is that she declined. So she declined on 1/1. And for the declined date field, you will also enter reason for declination, which really just gives you the opportunity to record a religious exemption for healthcare workers. So in this case, we might not know why she declined, or she said, I just don't want to. So that would just be declined reason equals other. So, and then a month goes by or so, and she decides to receive vaccination on 2/6. So then this down here at the bottom of the slide shows you what her row would look like. So she has her admission date of 1/1. She still has her declination date of 1/1. And then you don't delete this, but instead you also add that she received dose 1 on 2/6, and the dose was Moderna. So this is, again, a really cool feature of the event level COVID-19 vaccination forms within NHSN, that we can accurately capture individuals' vaccination status over time.
And that's just the first step of using that form. So if you remember at the top of the presentation, we mentioned that this was one way you could report your data for the weekly vaccination summary form. But in order to do that, you have to follow this step here. So once you've entered new or made modifications to existing rows of data, those rows will appear green, like row 1 in the example here, until you've clicked the View Reporting Summary and Submit button and submitted data for all of the weeks affected by that row. So we'll show an example of that on the next slide. But one thing I do want to point out, because we've been getting a lot of questions about this, in our examples here today, we're using lots of different dates. These are just data for example only. But remember, this is only available for facilities for you guys on the call, starting with that reporting week 3/28. So you'll see here, we're showing an example of 2/28, but for you all, you'll only be able to report back to 3/28 and forward, because this is a new feature.
Yeah, thanks for making that clarification. So backing up, so in this scenario, we either added this new person or we modified something on their row. So now this row is showing up in green because it has been either added or modified, and it has not yet been submitted to all weeks in the reporting summary. And so when you click this View Reporting Summary and Submit button, this is what it will look like. So it takes you to the reporting summary screen. And what you want to do is take this drop down here. It says week of data collection, first day. So this is the first day of the reporting week. And you'll click this and click the week that you want to submit data for. So let's say I clicked week 228 with, again, the caveat that this is just example data. You won't be able to submit until week beginning 3/28. So for 228, here are the totals that correspond to the questions on the cumulative summary form. And these totals here are auto-calculated based on the person level data that you entered. So you selected the reporting week that you want to submit for. And I just wanted to also point out that with the reporting week drop-down menu, it's designed in a way to try to help you realize which weeks have been updated based on the data that you updated in the person level information. So in this example, let's say I modified data such that it impacted all of the summary counts for weeks from 2/28 to 4/4. So you can see that I'm being prompted to submit or resubmit for all of those weeks because it says change since submitted using the tracking worksheet. So that means I made some adjustment to my data and all of these weeks were affected by that change because maybe it was an adjustment to a person who was admitted that week. So therefore, it wouldn't make any difference to all the weeks before that. So that's why you see these weeks as blank. But for all of these weeks, it has changed. So I'm being prompted to resubmit or submit for the first time for those weeks. And so once you've reviewed the totals over here, if everything looks to be correct, you'll just click Save and Submit Data down here, and then you'll receive a pop-up message that your data have successfully saved, and then you'll click OK. And you can see that the 2/28 week up here, it no longer says changed and submitted, it just shows the week. So that means now you've submitted the data for that week and it's fully up to date. So you'll click OK, and then you'll click the drop down again and see if you need to submit for any more weeks. And if not, then you just click done and you're good to go.
Now, since this is just one way to submit to the weekly reporting form, you can always go in and verify that those have submitted by navigating back to that vaccination summary tab. So just like when you upload record using the weekly reporting form or through Csv Upload, any completed weeks will appear green in this calendar view here. So I could click over to this view and see that I've reported data for residents for week ending April 3rd and week ending April 10th. And so that's one way to confirm those data. And if we want to take it a step further, the example on the next slide just shows the comparison of that summary form from the previous slide and the form that you would see if you were in the weekly cumulative vaccination module. And so you can see it's the same questions and the same totals. So just another way to confirm that those data are being transferred over exactly as you entered them.
All right, great. So now we're going to move into some frequently asked questions. Heather, are the event level COVID-19 vaccination forms required?
No, so we still have several other ways that you can capture and report these data. Those are shown here. So you can still go to that COVID-19 summary view, the vaccination summary data table, and report using the calendar view. Or you can use the upload CSV option and upload that CSV file for COVID vaccination summary data. We do, however, think that this is a way to simplify reporting, and there are a lot of advantages. So we would encourage the use of the event level form, but it is optional. So Hannah, we've touched on a couple of the advantages of this form already, but what would you say are some of the key advantages of this method over those other two methods we've discussed?
Yeah, like you just said, using the event level vaccination form can really simplify the reporting of the summary data because you just maintain the person level data and then you let the Nhsn application do the harder work of calculating and entering the totals. So that's one major advantage. And this allows facilities to document the vaccination information at the person level, which most likely many facilities are having to do in one way or another. So by managing this documentation of the person level information within the system, you can then make things easier on the reporting end because the system will calculate the totals for you. And like I just said, the Nhsn application automatically calculates and displays the weekly totals. So this just cuts down on a lot of the work that users are doing manually. Another important point is that given that users will no longer need to manually calculate and enter the totals in the summary forms if they're using the event level vaccination form, that will really simplify things as new questions come about. And we'll get into that a little later, but any questions that take into account how long has it been since this person has been vaccinated? For example, we will be adding questions in the next release for things like, is this individual up to date on COVID-19 vaccines? And this takes into account how long it's been since they received their primary series vaccination if they haven't had a booster. So rather than having to determine that on your own, the system will calculate that for you. So it's a big simplification when it comes to calculated fields and definitions. And then another thing that is unique about the event level or person level vaccination forms is that it allows users to record religious exemptions if they decline vaccination, which is something that a lot of facilities have requested. Heather, do you have anything else to add there?
No, I think that covers it. Thank you.
Okay. Heather, why can't I see the event level COVID-19 vaccination forms when I log into Nhsn?
Well, there are two possible reasons. One I see here, but I want to pause because I've seen this in the chat a couple of times. If you're really excited and understanding a lot of these advantages of the form, you might have logged into this webinar today, but your facility type is not a long-term care facility. So if that is your situation, just know that we are working to implement these into our other modules, but right now this is only available for the long-term care facility component. So that's one reason why you might not see those forms on login. The most common reason you won't see it if you're a long-term care facility, though, is because, as we mentioned at the start of this presentation, you have to have level 3 access to use this optional form. And that's because this is patient level data. So we want to make sure you have that extra level of security. So if you are a long-term care facility that cannot see these forms when you log in and navigate as shown on this screen here, we've provided some instructions to contact the SAMS help desk. And we have a phone number and an email address for you. And that will help you get proofed up to level 3 so you can use these optional forms. If you're not sure if you're a level 3 user or not, I've shown an example here of what it will look like when you log in as a level 1 user. So you'll see that top banner says NHSN level 1. And then you'll note that when you navigate to COVID-19, you only have options to report the pathway data or those 2 summary forms. You don't see the event level forms here. All right, so I've seen this question come up in the chat a few times as well. Hannah, can you state for folks, is this data automatically shared to the weekly vaccination modules, or do we have to submit it?
So you do have to submit it. The data is not automatically shared to the weekly COVID-19 vaccination modules. So what you have to do is make sure all of your person level information is up to date. And at least once a week, just go in and click the View Reporting Summary and Submit button and select the week that you want to submit data for using the week drop-down menu, and then review the totals and submit. So that part won't happen for you because you still need to review the data and make sure that it looks to be accurate before you submit it. So make sure you're logging in at least once a week and submitting for the reporting week of interest.
Even if nothing has changed, you would go in and select View Reporting Summary and Submit to report that over.
And Heather, how far back can I report event level data?
Yeah, so you can report data in the vaccination summary module for much longer period of time than you can use the event level forms, but we released these starting with reporting week March 28th through April 3rd. So you can use the View Reporting Summary and Submit option to submit data for weeks starting with March 28th through the 3rd and forward. And then I just want to remind folks here, just like with any other way of submitting these data, anytime you click Save and Submit, you'll be overwriting any data that were previously entered by another means. So if you enter data for residents in your calendar view, and then you navigate over to your event level option and use this Save and Submit option, your record will be modified based on the data that is in the event level form.
and vice versa. Whatever you do, whatever means you use to submit your data most recently is what will overwrite anything that's been submitted previously.
And we know that information changes often. You guys might get updated information after a reporting week. So Hannah, how do I update a record that I've previously saved?
Right, so you can just go in, you find the record that you want to update, and then you can just click on the cell that you want to update, and you can see that depicted here in the screenshot. So let's say I found out that this person's last name was not accurately typed in the first time around. So I just click it and I can backspace, I can add to it, I can do anything I need. If you find out that a vaccination date was incorrect, you can just click that and type over what's there. Or if you find out maybe this person actually didn't receive vaccination, you can click the date and delete it, and delete the manufacturer, which is done by, if you click in the cell, there's a blank row above all of the manufacturers. I've seen that question come up where people just aren't sure what to do. If there's, here I can show you, this is example data that I have. So right here, so let's say I found out this person actually didn't receive Janssen. I would just click this blank row here, and then that would make it clear it out. So there wouldn't be a manufacturer there any longer. And then after you've made any changes, be sure that you click out of the cell and click the View Reporting Summary and Submit button and share this new information for all weeks impacted by a change. Heather, do you want to walk through this example?
Sure, yeah. So this is going to follow the same steps that Hannah just described on the previous slide, but in this example, I'm reviewing the data for my reporting week. I've uploaded data for a new resident with resident ID NYCS. And when I click View Reporting Summary and Submit, I'm looking at my totals and I see that I have a total for 1 dose of Moderna vaccine. And so I realized that I accidentally clicked the wrong vaccine manufacturer for that resident. They actually received Janssen. So by reviewing those data, I realize I need to make an update, which I can do on the next slide. So what I'm going to do is I'm going to go back to the event level form and just click the cell that needs to be updated. In this case, it's that resident ID NYCS, and it's their dose 1 vaccine manufacturer name. So I'm going to move it to selected Janssen instead of Moderna, and then click outside of that cell and click View Reporting Summary and Submit to upload those data. And so now you can see that when I click View Reporting Summary and Submit, instead of having the 1 dose of Moderna, they're now being counted as a single dose of Janssen vaccine. So I already had another resident that had received Janssen, so that brings my summary to 2 for this reporting week. I've made my correction. I would review all my other data and then click Save and Submit to submit the data for week ending, for week starting 3/28 through 4/3. We get this question a lot too. We know staff turnover is something that happens. So Hannah, what happens when I've previously included a row of data for someone and then in subsequent reporting weeks, I realize that they no longer should be counted because they don't work for my facility anymore?
Right, this is a very common occurrence. So there's no option to delete any rows, but there is the ability to add an end date. So that's what you would do. And if you add an end date, so let's say this person stopped working in the facility around 4/13, then for any weeks after that end date, this individual will not be counted when you click the View Reporting and Summary and Submit and select a reporting week that does not include their end date. So this person would no longer be contributing to the totals by adding in that end date. So that's what you need to do if someone stops working at the facility or if a resident is discharged. You'll add an end date for an employee and a discharge date for a resident. And Heather, so we just talked about what to do if someone stops working in the facility, but what about if someone, what if a healthcare personnel goes on leave?
Yeah, so this guidance here is the same as our guidance for our summary form, because you'll remember that we are using this optional event level form to send data to our summary forms. So this guidance is unchanged, but if a healthcare personnel goes on leave that's 14 days or less and then returns to work, nothing on their row needs to be changed. You would just continue to maintain that information on the original row. However, so we would consider that temporary leave. If a healthcare personnel goes on leave that's longer than 2 weeks, so they return 15 days or more after that leave started, you would enter an end date on their first row. That would be the first day they began leave. And when they return to work, you would duplicate their row. You just have to click a plus button next to their row to do so, and enter a new start date, which would be the day that they've returned to work. So you would only have to change something if that leave was more than 2 weeks. So something like maternity leave, for instance. And Hannah, how about residents that are discharged and readmitted?
Right. So it's somewhat similar for residents, but there are some differences. And if you joined a previous webinar, you might note that this is a slight modification from the previous guidance for residents. But we determined that for residents, it makes the most sense to use, rather than a 2-week cutoff, we use a 1-week cutoff. Because for residents, our guidance in the table of instructions for the weekly summary form says to count all residents occupying a bed at this facility for at least 1 day or at least 24 hours during the week of data collection. So therefore, if a resident is discharged or leaves the facility for any reason and then returns or is readmitted to the facility within 1 week or 7 days, then like the example we just showed for healthcare workers, but in their case, it was 14 days. For residents, if it's 7 days or less, nothing on their row needs to be changed, and the information can continue to be maintained on their original row. This is because basically if they leave and then come back, if it's within that week, they're going to be counted for that week regardless. So it's really not that important to document every time they leave the facility. However, if a resident is discharged or leaves the facility for any reason for longer than 1 week or for longer than 7 days, or basically for 8 or more days, and then is later returned or readmitted after more than 7 days, you will enter a discharge date for the resident on the day that they were discharged or left the facility. And then when they return or are readmitted, you should duplicate their row using the plus button next to their row, and then enter a new admission date on their row. And the new admission date is the day that they return to the facility. And we have an example here to try to help illustrate that point. So in this case, we're asking, what if a resident is discharged and then later readmitted after more than 1 week? So initially, you're going to enter the discharge date when they are discharged, whether that's discharged to home or hospital or elsewhere. So in this example, we're looking at this row 2, 3, 4, 5. And so this resident was discharged originally on 2/1/2022. And then a few months later, they're readmitted to the same facility. So you click this plus button on their next to their original row to duplicate the row. And then when you click that plus button, you'll see that a new row pops up here, and it has all of the information from the person's original row copied into all of the cells already for you. So that makes it much easier to do the duplication. So then in this new row, you're going to want to delete the discharge date, because that's the one piece of information that we don't want to carry over, since this is basically a new time that this person is entering the facility. So you're going to enter the new admission date, which has to be more than 7 days greater than the prior discharge date. So in this case, the person is admitted for a second time on 3/25/2022. And they don't have a discharge date because they're back in the facility and haven't been discharged yet. And then you just want to review all of the rest of the information for this person and make sure it's still up to date, and then click Save Row. And that is what you do if a person returns, if a resident returns after more than 1 week. And this table just tries to summarize all of that information, because I know it can be a little confusing to keep straight. So we just wanted to put it all in one place for you as an easy resource that you can refer back to. So just reiterating what we just talked about. So you can continue including the person's information on the same row if it's a healthcare personnel and they return to work within 2 weeks or less. If you happen to enter an end date because you thought maybe they were going to be gone for more than 2 weeks, or you thought maybe they were actually leaving their role, but then you find out that they returned within 2 weeks. If you entered the end date and they returned within 2 weeks, you just simply delete that end date and then resave the row. For residents, if they were readmitted within 1 week or 7 days, you will include them on their same original row. And if you entered a discharge date because you didn't know how long they would be gone for, and then they returned within that 1 week, you simply remove the discharge date and resave the row. And then you add an end date and create a new row using the plus button to duplicate the row if it's a healthcare worker and they return to work after more than 2 weeks. And if it's a resident and they return or were readmitted after more than 1 week. So I know that was a lot of information, and please feel free to ask any questions about that and reach out for any follow-up you might have. So Heather, changing topics a bit, if I enter incorrect data by mistake and click save, can the row be deleted?
No, so as a general rule, we don't want you to delete rows, because one of the main benefits of this form is that we can carry information over time and see vaccination status as it changes over time. So once data are entered and saved, a row cannot be deleted, but it can be updated. As you'll see here, you can click into any of the cells and make updates. So if you enter data by mistake, we have a couple different options for you that I'll walk you through on the next slide. Best practice would always be to just review those data before clicking save. But once you have clicked save and you realize that there's an error here, this is sort of in order of preference. So the first thing you can do if you need to delete a row is repurpose that row with someone else's data. So if you realize that you accidentally entered a resident twice, for instance, within that 7-day period, so it's an unnecessary duplicate row, you could just go through and update all of the cells for that second row with another resident's information. If that's not possible, if it's the last cell that you have, last row you've added for the week and you don't have anybody else that you need to add information for, then what we would recommend is that you change the admission and discharge dates to a date before the form can be submitted, so before 3/28/2022. In this example, I changed those to dates in 2016 and 2020, because then they will not, the data will not transfer over to your summary form. We also recommend that you change the name and ID to avoid confusion, and also add a note in your comments column on the far right to document that it's incorrect. So in this example, I changed the first name and last name to accidentally entered, so that anybody from my facility that reviews these data can see that this is data that should not be counted. And I also included a comment that said that this was a data entry error.
Thanks, Heather. Yeah, and you want to make sure that you use a different identifier for the healthcare personnel or resident, because otherwise that row, if this is the true identifier for an individual, and then you enter that individual's row correctly, those two rows will be linked and the system could get confused, because there are certain rules in the application that are associated with individuals having more than one row. So just make sure you add a different identifier so that they are not indicated in the system as the same person. And also just reiterating that anything that has anyone who has a discharge date or an end date that's before 3/28, when the event level forms were rolled out, they will not contribute to the summary counts. So anything before 3/28, we won't be using for analysis, and it won't be contributing to the summary counts on your end either.
You can definitely still update those data here for your own tracking purposes, but just know that you won't be able to send data for weeks before 328 to the summary form. So we've said a couple of times that one of the main benefits of using this optional form is that you can track somebody's vaccination status over time. Hannah, do you want to walk us through an example of what that might look like?
Yes. So in this case, this resident was admitted on 2/21. And when they were admitted, their vaccination status was unknown to the facility. So on 2/21, the person who enters this information would also enter 2/21 for the unknown COVID-19 vaccination status date. And then a few days later, you learn that the resident is unvaccinated and you offer vaccination. This is on 2/25, and they decline vaccination. So then you would go in and enter a declination date of 2/25. And you do not need to delete the original unknown status date of 2/21 because it was true from 2/21 to 2/24, their status was unknown. And then as of 2/25, their status changed to decline. So we want to capture both of those pieces of information over time. And then around a month later, the resident decides that they do want to get vaccinated on 3/22. So again, we don't delete the original unknown status or the decline date because these are both important pieces of information. We simply add the dose 1 date of 3/22 and the manufacturer. So now the resident has 3 statuses over time recorded, which was unknown status from 2/21 to 2/24, declined from 2/25 to 3/21, and then vaccinated with Janssen beginning on 3/22. And you can picture how this would impact the weekly data that you submit. So for any weeks in between 2/21 and 2/24, this person needs to be contributing to the unknown status column. And then for many weeks from 2/25 to 3/21, we need this person to be contributing to the decline date field, or to the decline status. And then from 3/21 and forward, they're going to be contributing to complete primary series with Janssen.
Only need to update that row from week to week if their status changes. Otherwise, you don't need to do anything to the individual row during a current week if there are no updates for that individual, and they would still be counted when you click that view reporting summary and submit as whatever their last status was. So you don't need to go and re-enter folks every week.
Yeah, I think I saw a question in the chat about that. So once you have that person entered, you don't need to re-enter them. You just simply maintain their row as is and then update their information as needed if their vaccination status changes, like we just showed. Heather, am I supposed to be reporting vaccine data only on healthcare workers who worked in the last week or in a given reporting week?
Yeah, so we should still follow all of the definitions in our tables of instructions for our COVID-19 vaccination cumulative weekly reporting. So just like in our weekly summary, we report vaccine data on HCP who are eligible to work at least once per week. So those who work on a regular weekly basis. We've included a link here to those TOIs, but this is not a change. This is the same as if you were reporting cumulative summary data. We'll apply those same definitions here for which staff to count and make sure those are unique. If I'm somebody that is also entering data on the point of care or POC testing results form, should that identifier be the same on this event level vaccination form?
Yes, the identifier should be the same for individuals who are entered into both the POC form and this individual event level vaccination form. We strongly encourage you to use the same identifier. And we do plan to link the two systems within NHSN in a future release. So you'll be able to select an ID that you've already entered in one form or the other as you're updating the vaccination form or as you're entering a new POC test result. So it's important that as early as possible, you start using the same identifiers. And this also applies to state veterans home SNF users or skilled nursing facilities that are entering event level COVID-19 case data. We would encourage that you use the same identifiers here as you do for the event level COVID-19 case data as well. And similarly, those data will also be linked within NHSN in the future. And then also we've received some questions about what people should enter for their resident identifiers or staff identifiers. And really it's up to you and your facility, just anything that will make sense to you and that you can track. So we just gave some examples here of things that you could choose to do for the event, for the resident identifier and staff identifier. And you should choose something that's truly unique to the individual. For example, we've seen some people ask if they should use the room number for the identifier, but we would say, no, you should not use the room number because that's something that's not unique to the individual because someone else could occupy that room and have the same room number in the future if the resident is discharged or moved to another room. One option would be using a combination of things like initials, birthday, and room number. So for example, in someone named Jane Test, born on 1/5/1980 in room 201, could have a resident identifier of JT 0105/1980-201. And that's just an example to try to help you think about things that you might consider for your facility. But again, it's just whatever makes sense for you. And you just have to make sure that every individual has a unique identifier. Heather, where do we enter religious exemptions?
Yeah, so we've pulled all of these frequently asked questions from our initial event level vaccination webinars, questions that you guys asked. And we're also working to make updates based on things that we're hearing from you would make your reporting easier. So this is one example of those types of improvements. We've heard from a lot of folks that they would like a way to track when someone is declining their vaccination if it is due to an official religious exemption. And so if you use our optional event level COVID-19 vaccination form, we've created a field for declination reason. It's an optional field, but you'll see that one of those options, if you look at the example here, is that the declination was due to an official religious exemption. You can also choose other or unknown. So hopefully this helps the many users that have written to us asking for a way to track this religious exemption. So this would still count as a declination for the purpose of weekly summary reporting, but you have that documentation here. And this is another question I've seen in the chat a couple of times today. Hannah, can you help us better understand when do I click that view reporting and submit summary data button?
Right, so you should review the data and click view reporting summary and submit at least once per week. So you don't have to click that view reporting summary and submit every single time you update the data because you might want to be updating your data on a daily basis. But for your reporting requirements, you only need to report once a week. So therefore, our recommendation would be to do whatever works best for your workflow, but at a minimum, you should click view reporting summary and submit and resubmit data for all weeks that were affected by any changes at least once per week.
And what if I don't have any changes from last week?
Even if you don't have any changes, it will be important that you still go in and click view reporting summary and submit and select the most recent week to submit your data for. Because if you don't select that week, even though there were no changes compared to the prior week, those data won't be shared to the weekly vaccination summary forms. So at least once for every reporting week, you need to go in and click view reporting summary and submit, select the reporting week that you need to submit for, and click save and submit.
Thank you.
And we've seen some questions about being able to sort by columns on the event level form. So am I able to sort by the event level form columns?
Yes, you can sort by any of the columns on the event level form. We know lots of times folks want to sort by resident last name, for instance, or maybe by admit date. You just click on whatever field, that top column name that you want to sort by, and it will sort that column. And if you double click it, it will sort it in the reverse order. So I think it defaults to ascending order. So it would be for that last name, it would go A through Z. But if you wanted Z through A, you would just click it twice. And then, we've said at the start of the webinar that cells are green if it's a week that, if there is a week that was modified that hasn't been submitted to the summary form yet. But what if some of my rows are still green after I've submitted data for all weeks from 3/28 to present?
Yeah, so this can happen. The rows will remain green if and only if the individuals have an end date or a discharge date that is earlier than the first week that you can use the event level form to submit data. So in this example, these individuals were all discharged before 3/28, as you can see here with their discharge dates in January, February, and early March. So in this case, I've gone in and I've submitted for all weeks, but these people are still green. And we understand that this can cause confusion. So we're going to modify this in the next release so that the rows don't appear green if their end date is before 3/28, so that you don't need to, so that it doesn't appear that you still need, that you still have more data to submit to be up to date. But for now, just know that if you see rows remaining green, but the discharge date or the end date is before 3/28, you haven't done anything wrong. There's no way to submit those data to the summary form. So that's why you see them as green. So again, that will be a change in the next release to decrease any confusion that might be happening there. And Heather, sorry, go ahead.
Yeah, no, you go for it.
So if I currently use the optional Excel data tracking workbook, can I transfer the data that's in my Excel data tracking workbook to the optional event level COVID-19 vaccination form in NHSN?
Yeah, so I've seen some questions in the chat about this as well. If you've been using an optional tracking form, especially our optional Excel tracking form, and you want to upload those into the event level tracking workbook rather than manually entering all of those residents or staff again, there are instructions to do so. We describe how in our last training webinar. I'm showing the link here as well as a screenshot of where you would navigate to. So you would go to training, and it's that NHSN event level COVID-19 vaccination form training from earlier this April. There are slides that walk you through that. Our how-to guide also shows you how to do that. Along with just general instructions for uploading data through CSV Upload. So there's more on how to do that there.
Right. So in addition to the Excel version of the data tracking worksheet, you can also just do basic CSV upload to the event level COVID-19 vaccination forms. So we don't currently have this posted, but our recommendation, if you want to get a blank template that you can use to upload CSV data to the event level form, you can just go in and click Export CSV. And then you're going to want to make sure your data matches the formats and values in this document, which describes the process for CSV upload and all of the columns. So when you finish adding your data to the CSV file, you just save it and then click the Upload CSV button, and you're able to then see all of your data within the event level vaccination forms. And just a note that CSV Upload will overwrite records that have the same identifier and start date.
So it'll update any records that you've already entered in your event level. Mm-hmm. Yeah, the last thing I would add is just that it's so important to look at these resources we're referencing. If you try to upload a CSV of your old Excel tracking spreadsheet or any other spreadsheet you might have been using without first making sure that your columns match what's included in this template layout, that upload will fail. So you need to transfer the data to this template following these instructions here if you want to do a CSV upload. So that can be a way that it saves a lot of time for you if you're somebody that's been tracking this in another way and you want to get started. But we know it can be a little confusing, so you can definitely write to us for help troubleshooting. But those resources we mentioned on this slide and the previous slide are really going to be your best friend.
Thanks, Heather. And we just covered this one, but what happens if I have no changes in my data since the previous week?
Yeah, so this is so important. If you don't click View Reporting Summary and Submit, and click the week of interest, that data does not transfer to the summary form. So even if you have no changes, at least once a week, you need to go in and click that button, select the week that you want to report for, and click Save and Submit. So it's the only way that that data gets to your summary COVID-19 module. And Hannah, can you talk to us a little bit? I've seen some chatter in our Q&A box as well today. How should folks be capturing second booster doses?
Right. So currently we are not capturing second booster doses, but we are going to be capturing them in the upcoming release. So we'll be adding questions on the forms. On the resident form, there will be a new question that asks individuals who have received only one booster dose, and another question that asks number of residents who have received 2 or more booster doses. And also on both the resident and healthcare worker forms, there will be a question on the number of individuals who are up to date on COVID-19 vaccines. And the definition of up to date is a little complicated. It's defined as individuals who have received a booster dose, or if they haven't received a booster dose, they received their complete Pfizer or Moderna primary series within the last 5 months, or they received their Janssen primary series dose in the last 2 months. And for both of these, for all of these new questions, a major advantage of using the event level vaccination form is that the Nhsn application will use the vaccination dates that you entered for each individual and classify people as up to date or not up to date for you. And also for the only 1 versus 2 or more booster dose fields, the application will also, when using the event level form, make those classifications for you as well. So it really just takes all of the more difficult work out of it, because for the event level form, we will be adding additional booster dose fields. So it will say booster dose 2, and we'll likely also be adding booster dose 3. So all you will have to do on your end is just continue recording the dates that individuals receive vaccination, and then the event level form on the view reporting summary and submit screen will do all of the hard work of classifying people into these categories for you and summing up the totals. So this is a major advantage and a big reason why we are encouraging the use of the event level form, because not only will it make the data more accurate, but we really think it will make your lives easier once you've switched over to using this new system.
Yeah, that automation to summarize those calculated fields is a huge benefit.
And lastly, for CSV upload and also for direct data entry, for the date fields, can I list more than one date in a cell?
No, so each cell should contain only one date. So if you're entering via CSV, don't put a comma, just enter the first date, for example, for declination. And if you're using the form, so you're uploading in the application, when you click on that date field, it actually should show you a calendar that helps you select that date, but only one date, and it should be the earliest date that the event occurred. If somebody continues to decline vaccine once a month, that doesn't actually change how they're categorized. So we just need to know that first date that they declined vaccine. The only time that you would add a new date to their row is if their status changed. So if they decided to get vaccine, for example.
Great. And we've seen a number of CSV errors coming our way via questions that are asked to us in our user support. So this is a good thing to look for if you're receiving a CSV upload error. This often is causing issues. So just make sure you delete that second date and the comma. And just wanted to mention again, these are some of our resources that we have for event level reporting, and Sharice dropped these in the chat as well. And we really encourage you to take a look at these, and they can help answer a lot of questions, in particular questions about the Excel data tracking worksheet and CSV upload. I think you'll find these to be really helpful. In addition, we have all of our general resources on our website.
The more descriptive your subject line, the better. So Event level COVID-19 vaccination form is a great subject line. If it's a specific CSV question, you can enter CSV in that subject line. And all of those questions should go to our user support, which is nhsn@cdc.gov.